All right, we're going to go ahead and get started. Welcome, everyone. My name is Nick Zupan. I'm an epidemiologist with the Rock County Public Health Department. Welcome to another segment of Numbers with Nick. Today, we're going to be talking about something a little bit different than COVID-19. So that might be a nice change of pace for those of you who've tuned into these regular live streams. We're going to be covering something other than COVID-19. So anyways, if you do have questions as we move through the content today, feel free to put those into the comments section, and we'll try to answer any questions if they do come up by the end of the stream. So without further ado, we're going to jump into the content. Today, we're talking about the community health assessment that was conducted over the past year or so by the health department and partners across the county to get a better idea and get a sense of what are the priority areas with respect to health in Rock County, and how can we address those issues in those health priority areas. So you may have seen the news, we just recently released the report of this assessment, and we're now moving into the phase of the improvement planning process, which means that we're going to take the results of the assessment and start working on things in the community in conjunction with our partners and really try to make some changes in Rock County to improve people's health. So to get to the information in terms of the results of the assessment report, I'm just going to walk us through how we get there. So this is the homepage for the Rock County website, and you may be familiar with this, or you may be your first time visiting, but we do have a brand new layout for a Rock County website. So we have a nice clean look, and things are very well organized, and public health is right there in the middle when you come to the Rock County homepage. So you can go ahead and click on that. It'll bring you to the public health homepage, which is our department's website within the county's website. As you land on this page, you'll actually see this banner at the top. It shows COVID-19 information, and then it cycles between that and our community health assessment information. You can also get to the information by navigating to the Health Equity Alliance of Rock County link here on the left-hand portion of the screen. So the Health Equity Alliance of Rock County is a multi-sector collaboration, really involving many different stakeholders, partners, community groups across the entire county that are working to improve the health for all residents. So this group is really the lead organization driving the community health assessment and the work that we're doing to try to improve the health of our residents here in Rock County. So you can get some information about here and how to get involved, but what I'm going to focus on today is the community health assessment and the results of that assessment. So the first thing that's linked here is the community health assessment summary report. So as we pull this up, this is a short document that shows kind of a high-level overview of the process and talks about kind of just really the key findings and the main points throughout the whole assessment. So the full assessment is a very large document, and this summary report provides kind of a high-level overview summarizing some of the key takeaways from that assessment. So you can see key findings, you can see the top priorities that were identified, you can get some more information on how we involved health equity in the assessment through this process. There are some kind of big picture trends or maybe some data points that stood out through the process, including some strengths and areas for improvement. We also have kind of our next steps. So the final page of the document talks about what we're planning to do with this information. So I don't want to go too in depth into what this summary document provides, but just want to make you aware of its existence and the categories and the types of information we have there. We also have the same report translated into Spanish. So if you are interested in seeing that or want to provide that to stakeholders within the community, or residents within the community who are Spanish speaking, that is available as well. And then the other document that I want to pull up is the community health assessment report. So this is our 80-page full assessment report of the entire process. I'm not going to go through this document page by page, but want to call to your attention some of the important parts with respect to data. So I know this is a Numbers with Nick segment, and we do kind of deep dives. More often than not, it was always COVID data, but now we're going to be talking about some of the data and the methods that we used in our community health assessment and how we kind of identified the priority areas for Rock County. So we have on page 8, I kind of skipped a few pages. I didn't want to make anyone dizzy by scrolling through pages and pages to get to the methodology section, but here we are at the methodology within this assessment report. And I just want to talk about some of the methods that we used to complete the assessment. And so what we do is we kind of organize our partners and spend a lot of time planning our assessments and making sure that our processes and our methods are sound before moving ahead. We have a number of assessments that we try to conduct over the course of the overall community health assessment. And each of these individual assessments help inform our work. Then we identify these strategic issues and we formulate our goals and strategies to really try to improve the priority areas that were identified through this assessment. So through the assessment, the key pieces of data collection involved community conversations, community health assessment survey, key informant interviews, the use of secondary data, and a few additional assessments that I did mention right above. But what I want to focus on is kind of the community health assessment survey and some of the secondary data that we collected. So the survey was a 31-question survey that we developed with our partners that really tried to identify people's perception of health in their community and helped inform us of what are some of the key needs in the community and some of the strengths with respect to health in Rock County. This survey collected information on people's demographic information, their experiences in the community with respect to health and well-being, social connectedness, and all of the factors that may influence people's health and well-being on the whole. I'm going to show you the results of that community assessment survey in just a minute. And then the other portion of information that we collected was secondary data. So there's two types of data that we collect in this process. And the first is called primary data. And so that involves the community health survey, these community conversations, and key informant interviews. So primary data is data that's collected directly from our community members and stakeholders through this process. Secondary data is data that we collect from other sources. It could be data that we collect from the state of Wisconsin when they put their reports together and look at comparisons by county. It also includes data that's collected on a national level at the CDC. And if that data is provided at a county level or a sub-county level, we include that in our report. The idea is to gather as much information for this assessment to make sure that we're covering all of our bases and examining all aspects of life with respect to health and what the data is showing in terms of the needs of our residents. So in terms of the data, the secondary data, I have a few slides to show you some examples of the types of secondary data that we collected. You can also take a look at this full report to see the secondary data that was involved in how we analyzed that data and presented it in the following pages. I'm not going to go into that for today's presentation, but I do have a few slides that show some high-level overviews of some of the secondary data that we used for this assessment. So I'm scrolling and bear with me. So in terms of our results, one of the sections that we do have is our community health assessment survey. We have a total of over 1,000 responses that were collected through this survey. And I'm just going to navigate and show you what it looks like when you open this link and you want to see the results from that survey. So what comes up is the report of the 2021 Community Health Assessment Survey. These are all the responses that we received throughout the process of this survey. And it's broken down in a number of ways. So the first section of data includes all of the demographic data of the respondents. So you can see ethnicity, race, you can see the gender of those respondents, the sexual orientation of these respondents, age, disability status, and then what we start to get into is the total responses. So the first section is kind of when we group everyone's responses together, how does that data play out? And this report does provide the option as you mouse over these data points. You can see the specific labels and get a little bit more information in terms of the number of people who responded in a given way on all of these questions. Again, I'm not going to go through the specific data points contained within this report. I just want to make everyone aware that this is available and open for anyone who wants to see the results of that survey. The other feature of the survey that I want to briefly touch on for this video is that we do have this data broken out by all of the demographic factors. So forgive me as I'm scrolling through here. Each of the 31 questions that we asked on the survey are presented in terms of the total responses. And as we get down through the course of the data, we start to see a new section come up. And now we're looking at the survey response data by race. And so again, we're trying to provide as much data as possible and look at all of the different responses that we received and who's responding in what way based on race, ethnicity, age group, and those other demographic factors that I showed at the beginning of this report. So again, I'm not going to go through specifically in detail with all of these questions, but just wanted to make you aware that this data is available. And you can see these demographic breakdowns as you move through the report. Each of the 31 questions that were asked, we do have the responses based on the demographic factors as well. So those are some pieces of information that informed our work. And as we moved forward in conducting the assessment, we tried to include the experiences of all of our Rock County residents. So we didn't look at just the survey responses on the whole, but we also looked at the data based on all of those different demographic factors to try to identify if there were disparities between groups, whether it was age group or disability status or the other demographic factors that we collected. So I'm going to switch gears now and show you just a little bit of information. So I got to stop my share and then share a new screen. I go into presenter mode here. So just a little bit more information about the prioritization process and the data that kind of bubbled up to the top as some of those priority areas in Rock County. Again, this isn't a comprehensive look at all the data that was included in the community health assessment process, but really just a high-level overview of some of the main themes that were identified as the priority areas and things we really need to work on as a community moving forward. So you can see this is the process kind of that we follow. It's in some ways a linear process where we collect primary data and secondary data, and we use that to identify priorities with our community members. And so when we brought all of the data that came from the survey and the secondary data analysis to our partners in the Health Equity Alliance of Rock County, we started to prioritize the health areas that we wanted to work on in the next 3 to 5 years here in Rock County. And the top two priority areas were mental health and access to care. So I want to share a little bit of the types of data that we were looking at with respect to access to care and mental health. So in terms of access to care, this kind of encompasses a lot of different aspects of healthcare and health services, and really is trying to, the intention is to get people access to healthcare providers and also help people understand their health and what it means to be healthy and what types of behaviors and activities lead to positive health outcomes. And so a portion of that is also health literacy. So in terms of looking at some of our survey data, we asked people to rank kind of the difficulty that they have obtaining certain health services. And actually, the top health service that was most difficult for people to obtain was mental health services. A section about less than 10% of our respondents mentioned that they had trouble accessing dental health services, and about 6% of our respondents mentioned difficulty getting physical health services, which includes getting connected to like a primary care provider or a regular doctor. We also asked people questions about what were the difficulties that they faced and why were they having trouble obtaining healthcare services. So not only, this is a challenge, but why is it a challenge? What we found is that many people indicated that it's expensive to get healthcare. They also have trouble getting appointments, whether that's because of scheduling or their insurance isn't accepted. Sometimes it's really hard to navigate the system and know what numbers to call and how to explain that you need a certain appointment for a certain health condition. We also asked the question on the survey if people had the ability to obtain healthcare services when needed. And by and large, most people said that they always could get healthcare services or often could get healthcare services when they needed. But there is a large chunk of our population that indicated that they sometimes, rarely, or never were able to get healthcare services when needed. So that indicates that for a sizable chunk of our population, there may be some issues that we really need to address with respect to access to care. Like I said, we tried to look at the kind of demographic factors associated with some of these challenges. One of the findings from our survey was that those who reported a lower level of education, in terms of those who had less than a high school education, they often had more difficulty obtaining the health services that they needed. Some of this comes down to insurance coverage, economic factors, and other factors related to healthcare access and people having the ability to afford and get access to medical appointments and having insurance to cover those medical appointments. We also looked at our challenges faced by our Hispanic or Latino population here in the county. And one of the main barriers that they identified was that there are some language barriers, and that prevents them from accessing healthcare. When we compare those responses to those who identified as non-Hispanic or Latino on the survey, you can see a pretty vast difference in those who experienced language difficulties or barriers due to language compared to those who did not. Right? And let's see, when we're looking at our challenges based on race, we saw that Black or African American respondents in our survey mentioned that they did not feel welcome at a much higher rate than those who identified as white when they were responding to our survey. So again, these are areas that have been identified by our community by the responses on the survey, and offer some insight into areas that we can focus on as we're moving forward to improve healthcare access for all Rock County residents. Moving into mental health and the data that informed this priority area, we looked at things like deaths due to suicide among Rock County residents over the course of several years. So since 2010, we've kind of seen the numbers jump around a little bit, where certain years there are increases and then decreases, but by and large between about 20 to 35 deaths due to suicide each year, unfortunately. And so we're trying to look at that as an overall metric, but then think about some of the more specific data that could inform, what are the situations or what are the risk factors, and suicide is kind of that very high level data indicator related to mental health, but is something that we want to be aware of. Another piece of data that we collected through this process was the number of Rock County residents who report experiencing stress, depression, or problems with emotion on a monthly basis. And so based on the responses, it was about 4.3 days each month. So this is a fairly sizable chunk of people's time where they're indicating that they feel stress, depression, or problems with emotion. And, I know a lot of us deal with stress, but this is a key indicator in terms of just how prevalent some of these symptoms are with respect to mental health. And a lot of Rock County residents did report these symptoms. So I'm going to stop there. There's lots more data that we could talk about. And I'm just going to pause here and see if we have any questions that have come through. So at this point, I don't want to talk about any additional information. I know I've covered a lot through the course of this segment, and I know it's a little bit longer. It doesn't look like we have any questions, but I'm just going to pull up the information for a presentation that will be broadcast next week, kind of the results of the CHA process. So you got a little sneak peek of some of the content that we have been covering and some of the content that's in the report. But what we'll be doing is a community presentation that will be broadcast on our YouTube channel on Wednesday, March 30th at 6 p.m. And you can access that through the link here. We're also going to pop that link into the chat box below. And you can always find the full report of the community health assessment as I demonstrated, but also by going to this link that you see on your screen. So that was just a kind of a quick, brief overview of some of the data that's involved in the community health assessment and some of the main findings that we came up with through the course of the process. At this point, I'm going to close out the live stream for today. Didn't look like there are any questions. So with that, I hope everyone remains safe and healthy, and we'll see you in a couple weeks. Take care, everyone.